Hi, today I'm going to be doing a surgical wound dressing change, and I'm going to be using the sterile technique. I'm going to state to you my first 5, and you can watch for them throughout the procedure. The very first thing you do is you wash your hands always, and that's also to maintain patient safety and to keep everything sterile. The second thing you're going to want to do is ID the patient and any allergies, especially any allergies to whatever you are using at the time. Then you're going to provide the patient with privacy. You're going to shut the doors and the curtains, and you're going to keep the patient covered and maintain their privacy as well. And as well, the last and final step that you're going to do throughout the whole procedure and the whole time you're with this patient is you're going to maintain the patient's safety. Now I'm going to go ahead and begin. Knock, knock. Hello, my name is Amanda. I'm going to be your nurse today. Can I have your name and date of birth, please? Okay, I'm just going to check that. Okay, that's good. I'm going to go ahead and close the curtain and shut the door. Do you have any allergies, especially to tape or maybe cotton, latex, anything, alcohol that I may be using? No? Any other allergies, medications, or anything that I should be aware of? No? Okay, can you please rate your pain for me? You're having any pain? Can you rate it on a scale? About 2 out of 10. Okay, do you feel like you need any medication prior to what we're about to do? Let me explain to you what we're about to do, then you can tell me if you need any medication. The doctor has ordered me to come down, sir, and go ahead and assess your surgical wound that you have on your abdomen. I'm going to go ahead and change the dressing and keep it clean and progress it into healing. Any questions or concerns? And do you feel like you need any medication before we begin the procedure? Okay. I'm going to go ahead and wash my hands. Grab my gloves on. I've already gotten my supplies together and they are on my table ready to be opened then. Okay, I'm just going to have a peek here, sir. And I have a bed linen to cover you up. Go ahead and cover. And I'm just going to loosen the tape. Okay, I'm going to go ahead and take this off. I'm going to lift away from the patient so they don't see it. Okay, now assessing the bandage, you're going to see the color. There's a little bit of serous sanguinis, which is like a clear mix with a little bit of blood, which gives it like a pink tinge-ish. There's no odor coming off this that I can smell. The consistency is very thin, and it's a very scant amount, a very little bit. So we're going to go ahead and dispose of the old dressing. Now, looking at the wound itself, the skin has good integrity. There's 1, 2, 3, 4, 5, 6 sutures. I would usually go ahead and take something to measure this. It wouldn't lay on it. It would be above to give me the measurement in centimeters of the length. It could be width and depth as well, but this would just be a length because it's a straight cut. I don't notice any redness. The skin's just it's a little pink, but there's no redness and moist. There's no edema or swelling, no ecchymosis or bruising. Very little bit of drainage as seen on the bandage, and the edges are well approximated and it's on its way to healing. Okay, I'm going to go ahead and get ready now to change the dressing. I'm going to take these gloves off and just cover them. Wash my hands. Okay, the first thing I like to do is tape. Always get the hardest thing out of the way. I'm going to go ahead and get my tape ready. There's one piece. This piece is going to be for my cotton swabs. And this third piece, we're going to go ahead and initial date and time it. That way the next nurse coming in changes the dressing, knows when it was done. And while I did this prior, I made sure my table was clean and dry so there's no wicking for contamination. Nothing goes through. And I'm going to make sure that I maintain this dry table throughout the whole thing. I'm done with the tape. Now my swabs, I'll go ahead and open these, but I'm going to make sure I don't touch any of these with my hands because that would be contaminating, because then my sterile gloves would be contaminated. So I'm going to go ahead, open that, push them up just a little bit so I can grab them without touching. Go ahead and take the tape here, and I'm going to tape the back of this, and I'm going to tape it to my table. Okay. Next, I'm going to go ahead and open the gauze pad. I'm going to go ahead and pull this open and loosen this, and then I'm going to grab my 1-inch border, and I'm going to lift this backwards, making sure that nothing rips or tears in my 1-inch border. And I'm just going to move it back without reaching over it or anything. Now I'm going to go ahead with the abdominal pad. I'm going to open this here to my 1-inch border, and then I'm going to go ahead and grab this, making sure I'm not reaching over anything or contaminating anything such as the swabs or the other gauze. And then I'm going to lift this back, making sure nothing tears in my 1-inch border, and I'm just going to push that out of the way. Now for the sterile gloves, I'm going to go ahead and open this and open that. And this I can get rid of a while, so it's not in my way. I'm going to fold this back and this. I'm going to spin this. While I'm doing this, I'm making sure that my edges don't cross into my bandages for contamination. Because if they would cross over there, I'd have to throw that bandage out and get a new bandage. I'm going to go ahead and sanitize quick before I put these gloves on. Now I'm going to make sure that I only touch the inside of this first glove. I'm going to hold this 1-inch border, lift it up, make sure it doesn't move, step back. I'll have to fix that then. Now to get to the second glove, I'm going to reach in here. I'm going to hold it so it doesn't slide around and get my thing. Put my hitchhiker thumb out, step back. Now I'm going to put this glove on, and now I can fix this glove. Be careful not to touch anything. Slide my finger down in there because I can't touch the outside. And they're on. Now I have to keep these above waist level at all times. I can't touch anything else or they will become contaminated. I also kept facing this as well, because if I turn my back to my table, like such as now, it would be contaminated. But since I'm telling you, I'm still facing the table. So I'm going to go ahead and take swab 1, carefully not touching anything else, just the swab. And I'm going to go down the middle here. 1 swipe down. I'm going to go ahead and toss that, making sure we don't touch the bag. Swab number 2. We're going to go on the distal side away, from top to bottom. And we're going to throw that away. And the swab here, we're going to go on the proximal side close to me, from top to bottom. Okay. And we're going to take the gauze. We're going to put it over this, and we're going to take this, make sure the blue line's on the outside, lay that down. Now we can tape. I put the one with my initials up top. I'm going to dispose of these gloves as well. And clean up my mess here. And I'm going to wash my hands. Put this table away. Okay, sir. Just going to cover you back up. Do you want the blanket on or off? On? Okay, I'll cover you up. Keep you nice and warm. Any other concerns for me, sir? Okay, I'm going to go ahead and put this railing up to maintain your safety. Make sure you don't roll out. If you need me, here's the call bell. You don't hesitate. You go ahead and call if you need any medications, drinks, or if you just need to be repositioned or have any concerns. Thank you, and you have a good day.